Welcome to the DentiMax webinar on the charting screen. Today we're going to wrap up the items that we did not hit from our last charting webinar. If you missed that and didn't get a copy of the video, please go ahead and email us at training@dentimax.com and let us know that you need a copy and we will forward it over to you. But I'm just going to go ahead and dive right in and select my patient from my schedule. As most of you know, you don't have to choose a patient from the schedule. You can choose a patient from your patient list just by highlighting their name in blue, and then go ahead and click on chart here at the top of the screen. You can also get to their chart from the options menu on the left, or you can right click on the appointment and go down to view chart as well. So you've got several options to open up that patient's chart. Of course, right off the bat, we get our medical alert pop-up. One of the things that I think is important to know before we get into actually using the charting up top is that this section here at the bottom is displaying everything that's been entered at the top at one point. We have the date that these items were scheduled to be done or that they were completed, the code that is associated with that procedure, the description, tooth number, surface, what provider treatment planned or completed that item, and then the total fee for each item, the status of the item, and then the date that item was actually created. You can resort this data based on any of these blue headings. So I like to have all of my completed items lumped together, all my planned items together, etc. So I like to sort mine by status. So if you just click on status once, it'll regroup everything together based on the status of the item. Sometimes it comes in handy to sort by tooth number if there's a particular tooth where you want to see the history or the total picture for that tooth. You'll be able to see any existing restorations on that tooth. You'll be able to see completed items, planned items, and conditions as well. So tooth number can really come in handy because it's hard to see the whole picture when you have to look through each status for a particular tooth. So you can see right here, number 4, the only history we have is a post and core buildup and a crown on 4. And if we scroll down a bit further, you can see on number 30, we have an existing restoration of a amalgam on the distal occlusal surface. We're watching that tooth as well, and we're watching it probably because there's incipient caries on that tooth on the occlusal surface. So this helps you get a much better picture of that tooth if you look at it from that angle. If you click tooth again, this little column up top, you can actually resort in descending order instead of ascending order. So depending on how you'd like to see your information, that comes in handy. Another time this can really be relevant or help you is if you click a count code. That's actually the code that is tied to that procedure. So sometimes you might want to plan to do all your extractions together at one time, and this will help you see all of the extraction codes lumped together. In this case, I don't have any, but it does show, for example, all of our crowns are similar in coding, and so those all kind of fall together when we sort by account code. So I just wanted to go through that real quickly so you guys were familiar with these little blue headings and how those work. I'm just going to jump back to status and regroup by status, and you can see that we have one item that is treatment planned for today, and that's for a filling on number 29 MO surface. I do see that it is scheduled to be done today because I have a date under that date column for the planned item. The date created is just the date that item was treatment planned originally or put into the system as a plan that needed to be completed. So I'm going to go ahead and actually create a few more treatment planned items, and if we look up here at the odontogram, what I want to do is show you that you can change these teeth to reflect perhaps a retained primary tooth on tooth number 11, let's say. All I have to do is right click on that tooth and change it to a primary tooth. You can also right click anywhere in the mouth and change all teeth to primary. You can right click, change all to mixed dentition, or we can right click and change all to permanent. The computer will default the tooth chart based on the age of the patient, which is of course based on their date of birth that you plug into the software. So up to age 6 by default is going to show primary teeth, and then up to 13 will show mixed dentition. After 13, or if there is no date of birth entered, it's going to have permanent teeth. So from here, I just want to treatment plan a few more items. Let's go ahead and take a look at number 30. There's obviously a watch on that tooth because tooth number 30 is highlighted for me. Also, if I look down here at the bottom, I can scroll down and find all of my condition codes, and there we see watch 30. and incipient caries 30 occlusal. So I know what's going on with that tooth right off the bat. I want to plan to go ahead and do a filling on that tooth. They've got an existing amalgam there already, so we're going to remove that filling and replace it with a nice composite filling. So I just make sure my entry mode says I'm treatment planning, and it does say planned. I have my view mode planned selected, so I'm going to see what I'm doing as I do it. And then I'm going to find my restorative treatment and find my resin composite button just by hovering over these buttons. There's resin-based composite. Select that button and then click on the surfaces of the tooth that we need to do that filling on. Let's say you believe the incipient caries may bleed a little bit, so we're going to make this a 3-surface filling instead of just a 2-surface filling. So now we have 30 MOD listed down here at the bottom. We've got a nice plan already to do a filling on number 29 because there's a crack right there. I'm going to go ahead and plan number 7 incisal composite. Then we can do a class 5 filling on number 24 and 25. So we've got a few different fillings going on. I'm going to go ahead and also treatment plan to do a root canal. So that's going to fall under endo-perio-oral surgery. And let's just say number 18, turns out there's an abscess there. So we can click root canal and select 18. If I want to indicate there's an abscess there, of course, I'm going to go to my condition menu, and this little button right here with the circled root is our abscess button. So I select that and click on the tooth as well, and now we've got a circled root here indicating there's an abscess. If I just go back up here to the top, I have a really healthy treatment plan, and I want to go ahead and put this treatment plan in order for the front desk so they know how you're going to be performing these items. So what I'll need to do is highlight the items that I want as appointment number 1, and that's going to include tooth number 29, and since 30 is right next door, we're going to select that item as well. To highlight multiple items in blue, you just hold your control button down while you're clicking on those items, and then they're both highlighted. And then on my keyboard, if I want to put those in order, I'm just going to type a number 1. So now under order, we see these 2 items are the first order of business. Next, I'm going to select number 18. I'm just going to type a 2 on my keyboard. And then we'll do 24, 25, and number 7. So I hold my control button down, I select those items that I want to capture, and then I type a 3 on my keyboard. Now our treatment plan is put in order as to how we want to perform it. The next step from here is, on occasion, you may have a situation, perhaps on tooth number 18, where you might give the patient a couple options. You can keep that tooth, we could do a root canal and try and save it, or we can extract that tooth, and since you're missing number 15 anyway, it's perhaps not going to do you any harm. We could plan to do a partial or something else later down the road, maybe place some implants here. So if we want to create an alternate treatment plan, this is where our other tabs come into play right here in the middle of the screen. I'm going to click on the treatment plan tab, and then we currently just have one plan option, and that is our default plan. It was created on the 19th of this month. I'm going to go ahead and click New Plan, and you'll see all of the red planned items disappear. We're now looking at Treatment Plan Option 2. I can go back to the Charting tab and then start to plan out what we need to do here. And the great thing about this is everything else stays where it was. The planned items are the only things that disappear. So you can still see that there's an abscess on that tooth. You can still see existing restorations and other conditions that are laid out. So it gives you those clues to still make educated decisions on how to treatment plan. So my next plan is to extract number 18. So I make sure my entry mode says planned. I go to my options menu, find endo-perio surgery, and I can hover over these buttons until I find the correct extraction that I'd like. So this first extraction is actually better known as a simple extraction. And then we've got our surgical extraction for a partially bony tooth, and then completely bony. So I'm going to just go ahead and plan for the regular surgical extraction. So I click the button and click the tooth. And now we've got a treatment plan for that. Just for fun, let's go ahead and say tooth number 29. We're going to plan for a crown instead of a filling because there is a couple of cracks through that tooth. They may not be able to be fixed with just a filling there. So I find my restorative menu, and then I hover over these different crown buttons and try and find the one that I'd like to use. Perhaps we want to go with a porcelain fused to gold since that is a posterior tooth. So I select the button and then select the tooth. So now we have a treatment plan for option number 2. We can also put this one in order. Perhaps the most important thing is to extract that tooth. So I highlight it, type a 1, and then we're going to do the crown on number 29, highlight and type a 2. Now we have 2 alternate treatment plans. If we want to give the patient the treatment estimates so they can decide what they'd like to do, I just go over here to my options menu and go down to treatment estimate. Click on that. This is going to open up by default treatment plan 2 estimate because that's the one I had pulled up on the screen when I clicked treatment estimate. You can click this little drop down and toggle between the 2 different treatment plans, and you can also see the order in which each treatment plan was entered or planned out. From here, if I needed to change a fee or override the estimate for whatever reason, let's say we know that the fee on that is not $70, but actually should be $700. We can go ahead and plug that in as the fee that we're charging, and then the insurance estimate, perhaps you know the insurance is going to cover $400 of that. It's going to calculate what the patient owes outside of that for you. Then we can just hit save, and now it'll update the fee on that item. So you can manually override the estimates that the computer is coming up with on its own based on the insurance plan information. From here, I can go to my options menu and just click print estimate. And we have 2 different treatment plan options or treatment estimates to print up. I'm just going to show you the standard fee option first. So I'll select that, click the OK button. And directly on our screen, we'll be able to see their treatment estimate. If you'd like to print it out, the little printer icon is in the top left corner. So the treatment estimate will actually put together the treatment plan in order as to how you planned it and subtotal what the patient owes for each appointment, which is really handy. So appointment number 1, we're going to do these 2 fillings. Our fee that we're charging at the office is $428. The insurance allowed amount is $330. Out of that amount, we estimate the insurance to pay $244, and the patient's portion we're estimating to be $86. Appointment number 2 is going to be for the root canal. $1,000 is what we charge, $700 is the insurance allowed, $400 is what they'll pay, $300 is the patient portion, and so on. So this makes it nice for you to have your patient plan out what they'll need to pay at each particular visit instead of just giving them a total dollar value, and that might be a little intimidating if they're looking at a lot of treatment. If I scroll down a bit, we do have a total section here at the bottom of the screen, and then of course a nice little blurb for legal purposes and a space for the patient's signature and date. So you can print this out. If some of you are going paperless, I'm just going to back up a second and close that screen. You do have the option to click the sign button. What that does, if you have a digital signature pad and you have our document center, you can actually have the patient sign directly on this treatment plan. So it opens it up inside of the document center and has a nice space for a signature. We just choose the patient is the one signing the document, click sign, and then unfortunately I don't have my signature pad with me today, but we would see the signature scroll across the screen as the patient signs. You hit done, and you can actually save that document right into their document center, and it would have their signature right here on the screen for you to see. Now, if the patient wanted a copy, of course, you can print that out and hand it off to them for their reference. So if you are looking to go paperless, that is one of the ways that will help you do so. Now, another option here is, of course, we could go and click treatment estimate or treatment plan number 2. Again, print out that estimate and then have them both to compare side by side for the patient. Sometimes you don't want to overwhelm your patient and you only want to show them a couple things at a time. So let's just focus on treatment plan number 1. If I select multiple items here, let's just say the 2 items under the first appointment, I hold my control button to select multiples. I'm going to click print estimate selected, so it only shows those 2 items for me instead of the whole entire treatment plan for option 1. So now you can see that it helps the patient focus on just what their next visit is. I'll close the screen. Just going to check in, pause for a moment and see if there's any questions because I've been kind of running through this pretty fast. Okay, I don't see any so far, so it looks like you guys might be doing good. So what I'm going to do next is click print estimate and just show you the alternate alternate treatment plan estimate. The only difference between these two reports is the treatment plan estimate removes one of the columns on the screen. And so this plan is only going to show the insurance fee, the insurance estimate, and patient estimate. So it takes out the office fee section in there. Some people don't like to give that to the patient because they might run around and go shopping for who can do their work cheaper. So this just lets them focus on, this is what we're allowed to charge you based on your insurance, this is how much they'll pay, and this is what you owe. So you do have that alternate treatment plan estimate report to use as you'd like to. One other thing that I occasionally get asked is there's no exam or recall codes showing up here, and I wanted to give that to the patient as part of their treatment plan. All you have to do is click this little box that says show recall codes. Apparently I don't have any, but if I did, you would see them show up here at that point, like a pro fee or an exam, bite wings, that sort of thing. So if you want to have that print out on the estimate, just click that little box, show recall codes. Most patients have insurance that covers their recall visit, or at least a good healthy portion of it, and so therefore it doesn't typically get counted as regular treatment inside of our system. So that's a little box that you can toggle to and add if you need to. Another little tip in this portion, the treatment plan estimate screen, is if the patient does change insurances or their benefits change and you edit those inside the insurance info, you can open up this screen and click update fees, and that'll actually refresh the estimate that was on the screen from the previous insurance or recalculate based on what's currently in their insurance section. So that's a way to refresh the numbers that you're seeing here. I'm going to go ahead and close out of this screen, and then one more point I'm going to make here is that if I go back to the treatment plan tab, perhaps the patient decides that they want to go with option 1 versus option 2. You can actually select that plan and then click set as default, and it'll open that particular plan up every time you open their chart screen instead of option 2. And then vice versa, if I want option 2 to be the default, I just select it and click set as default. You can load whichever plan you'd like to the screen just by selecting it so it's blue and hitting load plan, and that's what you're going to see displayed on the screen. That does not mean it's the default plan. So you are able to toggle back and forth between these two plans and just view them before you decide, or the patient decides, which plan they want to go with. I'm just going to pull up treatment plan option 1 again and load that to the screen and set that as the default. You do have the option to select a plan and delete that plan out if you'd like to. If it's something that you did propose to the patient, I would keep that in the history for that patient just so you know that you did give them multiple options. And then in the charting tab, I would select those planned items and right click and mark them declined so that they do save in the system on a separate treatment plan, but not something you're going to be doing because the patient chose not to. So that's just a little extra tip there. I want to point out a few more items here in the middle of the screen. We can see the patient has Delta Dental of California for their insurance. Just to the left of that, we have a little note section. If we click on that, that actually will populate the notes of the insurance plan, which in this case, I plug in the frequencies and limitations of that particular insurance plan. So if you're wondering, for those hygienists out there, this is especially handy, how often your patient can have a pro fee or exam or the 4910 perio maintenance, etc. This is a great place to get that information without having to go to the patient's information screen and open up their whole insurance plan. That comes in really handy. To the right of that, we can see how much we've used plus what is pending out to the insurance, meaning an open claim, out of what their maximum is. So currently the patient has used nothing of their Delta insurance. We have nothing pending to the insurance, and then they have their full $3,000 max in our office available to them. They do not have any secondary insurance, so we have no information down here at the bottom of this. Lastly, before I move to the next tab, if you were needing to, you can print out a pre-authorization from this screen as well. Perhaps we want to know what the insurance will pay for the root canal. I can select it, go to my options menu and click pre-treatment claim selected. That just means that one item is going to be on my pre-authorization. If I click new pre-treatment claim, it's going to capture all of the planned items and have all of those items on the pre-authorization that we send out. So I'm just going to go ahead and select the one item, click pre-treatment claim selected. So we just have the one item we're sending out to pre-authorize. And we could go ahead and say yes to view that pre-authorization. There is very few differences on the pre-auth versus an actual claim. The main difference here is that under box 1, type of transaction, instead of saying this is a statement of actual services, it shows that it's a request for pre-authorization. And number 2 is down here where the item's listed, there is no date of service because the service has not been completed. So those are the 2 main points that differentiate this pre-authorization from an actual claim. Now, if I close that screen, that pre-authorization goes into my claim screen along with my regular claims and can be sent out with my claims batch at the end of the day or as you do it. You can see once we get here that that particular line is actually a faint gray color. That is your visual indication that this is a pre-authorization instead of an actual claim. So, moving right along, the next tab over is the Images tab. If I click in here, we do have an option to add an image, or you can click Acquire Image and maybe take a shot from whatever device you've got hooked up to the system. Just keep in mind that this space is very limited as to how much data it can hold, and so you really want to use it sparingly. If you have the DentiMax Document Center, and you have DentiMax Imaging or another imaging software, you should be taking your images inside of DentiMax Imaging, or if it's a document that you have, you should be loading it into the DentiMax Document Center. If for whatever reason you don't have either of those as options, and perhaps you receive a letter from another doctor or a provider that sent you over progress notes, you can click Add Image and load that document into this space. We have a space for a description. Let's just say it's progress notes. Put in the date that those notes were actually created, and then you have a little space for notes if you'd like. So this is the progress notes from Dr. Smith. And then in your options menu, you're going to click Load Image from File, and you would choose where that file is being held, select it, and upload that item into that space. Of course, I just chose a map of the area, and that would show up here right in this space. So again, keep in mind, this does not hold a lot of images. Some offices can use it as a default if they need a space for letters from other doctors, or maybe intraoral photos, that sort of thing. Just gonna pause real quick and see if anyone has any questions. Okay, and it looks like we do have one. The question is, this might be under an insurance webinar, but where do you plug in the system to know the insurance only allows what you can charge out so we don't overcharge the patient? That is definitely part of an insurance webinar, but I can answer that really quickly. Just going to click Ledger, go to the patient's ledger, and from here I'm just going to click on their insurance plan. The DEL02 is the Delta Dental. That is a hyperlink, and it's going to open up the insurance plan for the patient. This is where their frequencies and limitations go, and then the fee schedule that shows up on the patient's ledger and that shows up on that treatment estimate is actually coming from here. So the insurance fee schedule should be connected to the plan here, and at the bottom of the screen, the fee schedule that shows up on the patient's claim form should always be your office fees. So you're billing out the full amount to the insurance to possibly collect the most amount. And then on the patient's ledger and treatment estimates is going to be the contracted fee schedule that you have attached here. So I hope that answers your question. If you do have more questions about that, please reach out to me. You can just send an email to the training department, training@dentimax.com. Okay, and I'm going to pause one more moment and see if there's any other questions. Okay, looks like that's it so far. So let's just dive back into the next tabs over. The treatment plan tab, I think you all understand at this point, so I'm going to move on to the alerts tab. The alerts tab is pertaining to any medical alerts for the patient, and that information does come over from the patient's information screen when the front desk initially enters that registration information. So perhaps if the patient did not have any issues when they originally registered with your office and now they discover that they have a latex allergy, you can update that information here and it will update the patient information screen as well under the Alerts tab. As you mark these items off, it does create more information under the pop-up that we get when we open that patient's file. You can also see the items that I've selected listed up here at the top, so you don't have to scroll through the whole list to know what their issues are. You can just read it at the top of the screen. And if you are an office that is going paperless and you did already get our in-office patient kiosk, when the patient selects these items under their medical alerts, it will automatically check them off in your system after the front desk imports that info into DentiMax. So just a little side note, the kiosk is available for those of you who have been wondering. You can give us a call and purchase that now, and it will go ahead and select those items for you. To the right of this section here, we have any medications that the patient might be taking. I can just plug in the name here. Perhaps they are taking aspirin, and maybe they are taking one a day and they don't know the dosage. They just tell you it's one a day, and the purpose is for heart health. So that's how we can use this medication section. At the bottom of the screen, the patient alert, anything you type in this space becomes part of that pop-up that we get as well when we open the file, and it is a free-form space. You can see that I do have big, bold, and red my information right there. That's super important. Perhaps we just want to put a little blurb. Always call mom to schedule appointments, and never ask the patient for money because maybe they have some sort of arrangement with you. So while this is important, perhaps we don't need it big and bold and red. We can just highlight that, right click and change the font, and just set this to black, make it a little bit smaller, and we don't need it bold. We can make it regular. So you are able to change the font in this particular box. If we had already had a medication here and you just are verifying the patient's medical alerts, you can just select this item and click Mark Updated if they're still taking aspirin from the last time you saw them. It'll actually change the date modified to the day that you click Mark Updated. That way you know somebody had asked and verified as of today they're still taking that medication. On the left-hand side of the screen, again, all you can do is just look at the space and review what issues they currently have listed and just verify that those are still true. Moving right along to the notes box, I get this question a lot, is this where your progress notes go? And no, not necessarily. A lot of offices use this space for various reasons. You can right-click in here and do a date and time stamp, by the way, in case that's relevant. But what most offices tend to use this for is those notes that they would normally have written in the margin of the chart, they would add here because they're not necessarily part of the clinical or progress note, but it's something that they want to remember about that patient or have noted somewhere. So perhaps the patient always needs a pillow for their neck. Or you could plug a note in that says, daughter is graduating college in May. So you can make sure to tell them congratulations on your daughter's graduation. So little blurbs that you just want to remember about that patient can go here. Sometimes what some offices do is they take a look at both of the treatment plans and they might plug in a note here as to what their impression was from that patient about the treatment plan. So they could say, treatment plan option 1, patient seemed to be gravitating towards and will likely choose this plan. Maybe you put, we will send pre-auth out. So there's a note as to what your thoughts were from that patient, but that's not necessarily something that you would put inside your clinical notes. Okay? If you guys have other questions or thoughts as to what information we could put there, please, again, feel free to reach out and we can brainstorm and chat about it further at training@dentimax.com. Okay, so now the meat of the system here for the chart screen is the clinical notes. A couple things to know about the clinical notes first is they do have a date and time stamp. They also have a stamp as to who's creating that note. So whatever user is logged into the system, as you can see in the bottom right corner, I'm user number 1, and this is probably your name instead of a number, but that information is going to show who is actually making that clinical note. So if you want it to be you and not your staff member's name on that note, you can go to File, log in as another user, It will not close the system or change the screen. It'll just prompt you to put your own individual login into the system. And then it'll change the username that's listed at the bottom. From there, you could go ahead and add a line or add your note in. You can attach a tooth number to a particular note if this note is tooth specific. And you can actually add multiple teeth here. So just the note that I already have, for example, perhaps that was a note for tooth number 2 and 4. I would just put a 2,4 there. That helps that note become searchable later on. And if I just close my screen, as soon as you close it, it saves it. You notice there is no save button in the charting screen. And I'm just going to reopen it by clicking chart. Here's our alert pop-up. Always call mom to schedule appointments. There's their medical conditions, and then here's their medication. If I go back to the clinical notes tab, down here in the middle section, you can actually click view only tooth number 2, and it shows me all of the notes pertaining to tooth number 2. If I say view tooth number 5, I have no notes on tooth number 5, so therefore it does not focus into any particular note. So that's a nice way of sorting out your clinical notes. I can also view the notes based on who created that note, the user that's assigned to it. So if I say I want to see all the notes Albert created, Albert hasn't created any notes for us yet. So that's another way that you can sort out and view specific items. You can actually backdate these notes. So if you get to the end of your day and you just don't have it in you to make a clinical note, you want to do it tomorrow, you can actually change the date on the note up until the point where the note is locked down. The note will automatically lock down after 10 days from the date you created the note. So not the date that's on here as the date stamp, because again, you can backdate notes, but the date of creation. So the note here that's with the gold lock, that is the one that is locked down already. So if I try and delete that note, it's not going to let me. So it says the note is locked and cannot be deleted. So you cannot change a note after it's been locked down. But up until that 10-day mark, it is totally editable, and you can lock the note sooner if you'd like to. So perhaps I have my little note here and I click the little lock button. It says, do you want to permanently lock this now? We'll say yes. And now it's locked in, and now it's no longer editable. You do have a little expand and minimize button here. So if you wanted to shrink up some of these notes, you can certainly do so, and then just see the date and time stamp and the tooth number and user code associated. So that's another hint for you right there. And then I could expand everything once again. So you can shrink them one at a time, expand them one at a time, or shrink all, expand all. So you just saw that I could click add line and just type out a freeform note. And obviously, I think everyone is probably sick of that option. It makes it a lot easier when you can just automate your notes, but sometimes you may still have a use for adding in a little blurb that doesn't really pertain to a clinical note template. If we are going to use a template, we're going to click add note. That actually pulls up my template list, and we've done a bit of work on these templates. If I click through the different menus, you can see we've got a number of clinical note templates listed in the system now. I need some help from someone on an Indo note if anyone wants to volunteer. So we do have a few options there, or oral surgery, could use some help on that one. Those are defaulted in a lot of the systems for our newer customers. Now, if you have an older set of templates and you'd like to replace them with the new set of templates, you can call our technical support team and they will replace those for you. Just keep in mind, if you do replace them, it will wipe out all of the old templates that you're used to having, and you'll only have the new templates. So just make sure you check with everyone before you do that if that's something you're interested in. My clinical note templates, as you can see, are color-coded, although they come black by default, so I just like to have mine a little bit different. And I color code mine based on procedure type, so that when I'm looking at the screen, I can see a note and automatically know that that's a restorative type of procedure note. So you are able to do that if that's something you'd like to. Also, my notes are a little bit bigger in size than the default. You can edit the template and make the font size larger if you'd like to as well. So I know some people just prefer to not squint a little and they just want to have the notes bigger by default. You can absolutely change the templates and set it so it comes up larger every single time. You can create your own categories of notes here on the left-hand side, just by right-clicking in this space, click Edit Categories, and then click New, and you could create a new category. And then once you choose a category, you can actually choose a note to use, or you can click New Note and create a new template. I'm going to walk through how to use an existing template first, and then I'm going to go ahead and show you guys how to make a template. So to keep things somewhat simple, I'm going to go to our routine section and choose our Prophy note. So it's highlighted in blue, and I hit select note. I now know that I'm applying this particular note to my patient, because at the top I see we're note building, and we're building for test, which is our patient name. So here we can see the medical history was reviewed and updated. That's just a statement we have listed. And then we have intraoral exam or intraoral inspection. And then we have a space for IO, and it says 49. 49 is just representing the number of question that is listed out here. So basically the question, if we look over here off to the right, is, was the intraoral exam within normal limits, or were there exceptions in that exam that you want to note? So that is question number 49 in our template section. We have our space. We're asking about the intraoral exam. On the right-hand side, we're actually going to answer the question. So if it was within normal limits, I can select WNL, and you can see that populates here on the left-hand side, and then I just hit my next button. We have the same question for extraoral exam, and instead of making a whole new question that says EO instead of IO, I just reused that same question number 49. So the extraoral exam, was it within normal limits, or were there exceptions? I could choose within normal limits again, and you can select it quickly by double-clicking on it instead of selecting and hitting next. But in this case, I'm going to go ahead and double-click on exceptions. Because there were exceptions, I created a free-form space that you could type out what those exceptions were. So perhaps they had some nodes on the right side of their neck that seemed swollen. So I could say swollen nodes right side of neck. And now that I have my answer populated, if we look over here to the left, I could see the extraoral exam had exceptions. There were swollen nodes on the right side of the neck. You could keep typing and add in a whole book of information here if you need to. We're going to keep it short and sweet, and I'm just going to click the next button now that I'm done answering that particular question. The next question is, the perio charting, was it completed? And then off to the right, you're going to answer yes, no, or not applicable. Again, here the quick answer, or the quick way to populate an answer, is to just double click your answer. So I'm going to double click yes, and then it automatically moves on to the next question. Did you use the ultrasonic or hand scale? Perhaps today we did both. So I double click ultrasonic and hand scaled. All of the answers that we have on the right hand side, these can be customized in addition to the template layout and the format that we're seeing here. So just keep that in mind as we're getting to the next portion of the webinar. So calculus, we're going to go ahead and say it was mild to moderate. And then plaque was also mild to moderate. And you can see I'm reusing the same set of answers over here, and that was question number 13. So you can keep reusing those questions. You just have to make them a little more generic instead of saying intraoral exam, extraoral exam. For example, in this case, I just have a severity scale, and then we could attach that severity scale to anything we need to. Then we move on. We polished and flossed. Oral hygiene instructions were given. The patient's next visit, and then I do have a question, number 22, which is what is the next visit? Off to the right, I see what is the patient's next visit. We can choose 3-month recall, 4-month, 6-month root planing and scaling. We're going to continue their treatment, and that indicates with the doctor. We're going to do a custom tray, or we're going to deliver something. So perhaps I'm going to choose 6-month recall. And then if we referred them out, I have a question for referral. These are the 3 people that I refer to. And what would be great is if we had another option here that was just the word that said none. So you can either choose a particular provider or say we're referring to none or no one, or NA would be more applicable here. So I'm just going to say we referred to Dr. Jones. And then our template is here. We can actually click and type directly inside of this template and make changes to anything we need to. after we're done answering all of the questions. You can't go back and change things when you're in the middle of answering or populating those questions. So from here, since I made changes, we'll just take Dr. Jones out and I'm going to put not applicable. I click Save Note. And once the note is on the patient's clinical note tab, we can still click and type and make changes anywhere we need to, up until the note is locked, which again automatically happens in 10 days. So that's how we actually use or work through one of the templates that we have on file. Now, the next step is how do we create these templates? And before I get into that, I'm just going to pause real quick and see if there are any questions. Okay, it looks like we've had a couple come through, so hang tight just a moment. Okay, so are there pre-existing alerts to check off, or do I have to manually put them all in? My screen does not show any. So I think what you're talking about is the alerts tab here on the left-hand side. These alerts, they should pre-populate unless someone had deleted them or for whatever reason your version didn't come with it. If that's the case, please call tech support and they can load that table for you and get the standard set of alerts. However, you can also create your own medical alerts. It's done under the setup screen, and then we click Setup Alert Codes in the bottom left box. And then from here, just click New Alert and enter in the alert name. I'm just going to put hi. You want to enter in the description of the alert and hit Save Changes, and it's creating a new alert for us. So here's that one alert that I added, and that will populate the alerts part of the screen. Great questions. Okay, so let's go ahead and get into making the clinical note templates. Again, I need to click Add Note to get into the note section, which, by the way, you can also get into the clinical notes at the top of the screen by clicking Add Note. I know it's lesser used up here because usually people are doing it from within the charting screen, but just know that that is an option. And then I'm going to just go ahead and make a note for a filling. I already have one, but just to show you an alternate example. So my filling goes under restorative treatment. I'm going to click New Note, and I'm going to give this a description. And I'm just going to call it filling. And again, it's going under the restorative category. And then here, I'm ready to begin my notes. What I'd like to say is try and establish a pattern for yourself. Do you like to see your notes in a paragraphical format, or do you like them listed in the way that I have them, which is more of a line-by-line format? And so from there, you can start building your note. The best thing to do is type in the default information first and leave a space for where you're going to want to insert a question or a space for something that's going to be a variable answer based on that patient or that particular visit. So I am going to go ahead and get started here and just put medical history reviewed and updated. They say that is the best way to start your clinical notes. Do what you want to do. It's your clinical note. It is your representation, so it's up to you. The next line, I'm just going to jump a line down. I'm going to type in patient presents for, and then I'm going to actually put a little blank line right there because I want to go ahead and put an answer into that space. So patient presents for blank today, and consent was given. Consent forms have been signed and are on file. Again, the content of the note is up to you as to what you want to put in there. Some doctors think this is overkill. Some doctors put in more information than what I'm about to. So it's totally up to you as to how far you go with the note. The great thing about the template is you type it all out once and then you never have to type that level of detail again. We began today by using blank topical anesthetic. And then you can see this is more of the paragraphical format. Then I administered blank carpiol. This could be multiple carpiols, so I always do a little S inside parentheses, carpiol or carpiols of blank. So this is, what did you inject the patient with? I then removed the existing restoration, and let's say that that is applicable. You can go ahead and have that in there. If that's not something that's common, because of course not everyone has an existing restoration, you could leave that out and just plug in a space for free-form entry if there is anything additional you want to add or unique to this particular situation for the patient. I'm just going to go ahead and put that in parentheses, and I'm going to insert a free-form space as well, just so you guys can see the difference between the two options of adding a statement like this versus having a space to do a free-form entry. So I'm just typing a little reminder for myself to add that here. A lot of offices are starting to plug in the reason why they did that restoration and then using the clinical note as a narrative for the insurance company. So the front desk doesn't have to bother you and say, why did we do this filling? They can just grab your narrative and attach it and send that with the claim. So I can say reason for filling, which you guys have seen perhaps in other templates, but I'm going to, again, do two different options here to show you different examples. Let's just say the filling was required due to, and then have a space there to answer that question, and additional comments, or I can just, again, have a free-form space there that I plug in additional comments. So I'm kind of mixing up this template to show you a few different ways you could populate information. I'm going to go ahead and say assisted by Joanne. And then next visit is, from here, once you're done making the foundation of that template, we're going to go back to those spaces that we had added and take those out and actually insert questions into some of the spaces and not others, so you can see the difference on how this plays out. So patient presents for blank today, consent was given. The easiest way to answer that or manage that situation is to insert a free-form space that'll just populate whatever you type in. So down here at the bottom, I can go down to insert a question. I suggest always looking through your existing questions before you create a new question. The question is only there to represent or populate the answer that you choose. So if I had not typed out patient presents for, all it would say is whatever answer I select instead of patient presents for the answer that I've selected. So I hope that makes sense. Again, feel free to email afterward if you have questions in particular. So we can scroll through this giant list and search for something that makes sense to plug in there. In a lot of times or cases, I've created a free-form space question, and the answer that goes into that space is what's going to populate that little spot right there in between for and today. So I'm just going to select that. I did a keyword search for free-form, so I select that and click Use Selected. And now, instead of having a blank line there, I have that question number 20, which is a free-form space, and that's going to be replaced by whatever answer that you type in. You want to make sure you do have appropriate spacing here because it will read just like a sentence will, or any commas or periods or anything like that. Make sure you populate those there. So patient presents for, whatever populates in that space today, and consent was given. Consent forms have been signed and on our file began today by using blank topical anesthetic. So here, again, I want to take that line out, go down to insert a question, look at my existing questions, and we do have the first one right here is topical anesthetic. I can select it and just hit use, or if you want to see what options are inside of that question, just click the edit button. And when that question is used, this is how it shows up. There's a description of the question and then the actual question that it's asking, and we could expand upon this. What topical anesthetic was used? And then we have different types of answers that you could plug in. In this case, we went with a list of answers and then we created our list. You can choose free-form entry as a means to answer the question that we have here. You can choose a date selection. You can choose tooth selection or surface selection. We're going to leave ours as list of answers. We have lidocaine, benzocaine, tetracaine, Orachix, and no, meaning no topical anesthetic was used. If we had additional answers that we wanted to plug in, I just click Add Answer, type it in. I can't think of one right now, so I'm just going to repeat. So I'll say Lido, and then you can reorder where that answer goes just by clicking the arrow up or down button, and then I hit Save. So now I can select that question. You can see the description has stayed the same, but the actual question has updated. And I'll click Use Selected. So now here, we began today by using topical anesthetic is question number 1, and that was the topical we used. Then I administered blank carpioles of blank. So this is asking how many carpioles of what did you give the patient. So I took that little line out, I go to Insert a Question, Existing Question, and then we're looking for how many carpioles. So there's carpiole right there. If I'm not sure what that's going to give me, I select it and hit Edit. This is going to give you 0, a half carpiole, 1, 2, 3, 4, 5, 6, 7. So in most cases, that should be appropriate. So I'm going to go ahead and use that existing question. I'll select it and click Use Selected. Okay, so that is actually question number 2 in our listing of questions. So I administered carpioles, this is going to be a number, and then of what. So I take out my line, again go to Insert a Question, Existing Questions, and I'm going to look at this anesthetic dosage, which is question number 3 on our list. If I click Edit, we'll be able to see the options that are listed here. So we have articaine 4% with epi, bupivacaine 3%, and so many carpioles of lidocaine 2% with epi, lido 2% with epi, bupivacaine, and then perhaps we want the lido 1 to 50,000 option in here. I go ahead and click Add Answer, and I'm a copy paste girl, so you can use your Control C and Control V to copy and paste, and just change what you need to on here. So lido 2% with epi 1 to 50,000. And I can move this up on the list if I'd like, if that's more common. I do want to point out that there is a blank line as an answer in here, and there is also this question which we call a looping question. What that means is we have an answer, but if we choose this answer, we also get an additional question that we could plug in. So this is for people who use cocktails for their anesthetic. So we don't want to have to plug in that question of anesthetic dosage twice on the chance that you might have to do a cocktail that day, but we want something inside here that'll handle that situation. So if we choose bupivacaine 3% plain is the base of the cocktail, and we have an existing or another question here of how many carpioles of lido with epi did you use. So this is going to let us answer a question within a question. To create a looping question in your list of answers, you would type out, for example, articaine 4% with epi. I would say and I can right click in here, insert another question, and say how many carpioles of, and then I could just type out an answer, or I can insert another looping question to answer or choose another option from my anesthetic. So I might have lost some of you on that, but bear with me and it'll start to make sense in just a minute. Anytime you do have a looping question or a question within a question, you want to make sure you do have a blank line as an answer in your listing of answers. If you don't, you won't be able to get out of this question. It'll just keep asking you the same questions over and over and over again. Okay, so that blank line is really super important. I'm actually just going to take that portion out because we already have a looping question to show you, and so we'll use that in a minute. So I'll hit the save button, and now we've edited anesthetic dosage. I'll select that and click Use Selected, and that's going to populate there for me. I then removed the existing restoration or freeform entry is kind of what I was going for here. So I'm just going to take out the freeform entry portion and go to Insert a Question, do an existing question, and search for my freeform space. Use that question or answer section, and I'm going to show you how these two differ in just a minute. The reason for filling, we do actually have a question that has reason for restoration, so I'm going to look through my existing questions once again and just type the word reason. So we have reason for restoration, reason for root canal, reason for extraction. If I click reason for restoration and click edit, you can see we're going to have a number of different options in here. this is also being questions on each one item that you answer, because sometimes you do a filling because there's a cracked tooth, but there also might be an existing restoration there, like an amalgam that's leaking. So you don't just want to select cracked tooth, and you don't want to select just leaking restoration. You want to choose both. So those looping questions will give you the freedom and flexibility to select multiple answers. When you're done selecting your multiple answers, you're going to choose the blank line that, again, you want to make sure you've added in there. In this case, I'm going to use reason for restoration, use that here, and then I'm going to show you the alternate, which is the filling was required due to. I'm going to insert a free-form space there to kind of show you your options. Additional comments, we could just leave that as is, assisted by Joanne. If you have multiple assistants, you can create a listing of answers as a question and have each person's name as an answer, and then just select who assisted you. And then the next visit, let's go ahead and look through our existing questions, and we do have a next visit option in there, but let's go ahead for fun, just create another one. So this existing next visit is going to show you the recall, treatment, etc. Let's say what we want to put in as an answer there is the date of their next visit. So I could click new and create a new question. The description is next visit date. And the actual question is, what is the date of the patient's next visit? And then the type is going to be, what type of answer do you want to populate that? You can do a free-form space and type in the date and then put in what they're coming in for as well. Or we could do a list of answers like we had in the previous one, or we could just do date, and it'll actually let you select a date. For tooth or teeth selection, it just lets you click little boxes for the different teeth numbers that you worked on that day perhaps, or that are relevant. Surface selection just lets you select one individual surface at a time. So if you want something that's like surface selection, what I'd suggest to you is creating a list of answers with the main surfaces and then creating a looping question to select subsequent surfaces if it's more than a one surface issue. So I'm just going to go ahead and choose date in this situation, and now we have next visit date. I can use that selected, and before I save this template, and I can see I'm building my template here at the top, I want to go ahead and change the font on this because it's a little small for me. So I just highlight everything, right click, go to font, and I'm just going to bump it up to 14, and you can change colors and how that gets displayed as well, or even the actual font if you'd like. Click OK, and now I'm going to save this template. You don't want to change the font until you're done making the entire template, because if you continue to make changes, it'll revert it back to the original font, and then you'll get frustrated. So here's our filling template we just created. I'm going to select it, and I suggest always working through that template so people can see the flow of it and how it actually works when you're done. So I hit select note, and medical history was reviewed and updated. Patient presents for, we have a free form space right here. You can see the cursors blinking. So the question disappears in anticipation of the answer that you're going to populate there. If you're not sure where you're at on the screen, just start typing something and you'll see it pop in. So patient presents for filling on tooth number 5, DOL today. Okay, so my answer just gets plugged in right there, and then I could click the next button, and consent was given. Consent forms have been signed and are on file. We began today by using, and then we're asking what type of topical did we use. Here's the answer I added in for Lido. Obviously just choose whichever answer is appropriate. If you did not use anesthetic, or topical anesthetic rather, we're just going to select no topical anesthetic. So again, you could word the starting point of this statement a little bit better to allow for the word no to get placed in there so the sentence reads appropriately. So that's something you want to think of as you're building these. Then I administered blank carpules of blank dosage. So go over here. We'll choose 2 carpules of, we could choose just a simple one, mepivacaine plain, or in this case, I'm going to show you the looping question. So I'm going to double click mepivacaine 3% plain, And then it's going to ask me, so we used 2 carpioles of mepivacaine, 3% plain, and how many carpioles of Lido with epi. So again, it lets me answer how many carpioles because carpioles was built into the answer of the first question. So that's how the looping question works. Now, because there was no additional loop outside of that, if there was another question, I would have had to eventually click a blank line to get out of that loop. In this case, it closed the loop automatically. I then removed the existing restoration. I'm going to still leave that as is, and then I have a slash, and then I plugged in my freeform space. So this is where you could actually put your patient-specific notes. If you don't want to have, I then removed existing restoration. So I could say removed old amalgam and cleaned up margins of the tooth. Not every filling you do is because of an old amalgam, so that's why a freeform space really comes in handy to let you type out what you actually did for that particular patient's visit. Then I could click the next button, the reason for the filling, and here's another example of a looping question. Maybe there was decay there, so I could choose my decay option. It's going to ask me what the decay grade was, and then let me answer again the reason for the restoration. So we'll choose decay. Decay grade was moderate or severe. And then was there another reason I did that restoration? If so, I can go ahead and select that was an old amalgam with wear. And then we have that populated. Was there another reason we still did that restoration? I could keep choosing. Once I'm done choosing, I double click the blank line. Okay, so reason for filling was decay, it was moderate, and there was old amalgam / wear on that tooth. The filling was required due to, here's your alternate option. I had a freeform space go right there. And here I could say moderate decay and an old existing amalgam with wear on tooth. So this kind of shows you side by side how you could set up those question and answer sections based on what makes more sense to you and how much typing you like to do. Then I could click the next button. Additional comments, I intentionally skipped past that one, and then we were assisted by Joanne. Our next visit is, and I get to select a date. So we can actually just go to, let's say, December 2nd, and then hit Save Note. So I wanted to go back to the additional comments option right here, because if you just do something like this, where you say additional comments and you don't insert a freeform space to answer that, you'll just have to remember to go back to that here and type in anything additional that you want to note. So keep in mind, if you're not plugging in questions, the question, the answer will not be represented there. You'll have to go back and add it in once you're ready to save that note at the very end of the template. So just as an example to show you. Okay, I know that was a ton of information and we're over our time. We tried to cram a lot in today. So of course, again, the video will be available, but if you have specific questions, feel free to email training@dentimax.com. And I'm just going to check and see if there's any people hanging on with last minute questions. Feel free to throw them out at me. So there is a question, is there a reason why after writing up my note, I have to close the screen, then go back into the chart screen to see the note, and it doesn't pop up unless it closes? That is probably something based on the service pack that you're on in your software. I think that if you're on an older build of the system, it doesn't automatically refresh is basically the issue there. The note is still there, but because the screen saves automatically and it's not auto-refreshing for you, you're not seeing it until you close, and that essentially is the auto-save button. What you'll want to do is call tech support and just get on the latest build of DentiMax, which is Service Pack 3. If you go to the Help menu at the top of your screen and go to About DentiMax, right here it's going to show you what service pack you're on. So if you're on anything other than Service Pack 3 or any Service Pack 3 that is not for 7/21/16, please call tech support and get that updated, and you'll want to make sure it gets updated on every computer in your office, not just the one computer that you work on. So consistency amongst the program is important. Anyone who isn't, you want to update to Service Pack 3 for 7/21/16 is the date of this release. So that's the version you want to be on. And just going to check and see if we've got any other questions. It looks like that may be it. So if you guys do need anything else, reach out to us, training@dentimax.com, and we will be more than happy to help you. You can purchase training time. It's $99 an hour. We do sometimes have specials, so please call into the sales department and ask about that if you feel like your office staff needs dedicated training on this. Otherwise, the video will be available for you guys for free. You can take these tips and learn from it. And watch for our next webinars and tips of the week that we have going out to help you, and those are always free. If you haven't done so already, you'll want to subscribe to our YouTube channel. So just go directly to youtube.com, type in DentiMax into the search space, find our channel, and click the subscribe button. And that way you make sure that you're on our video mailing list. So please make sure you guys subscribe to that to continue to get these videos and updates as we have them. If you do have questions, you can call us as well, 1-800-704-8494, extension 2 for training. Thank you so much, and we look forward to helping you further. Take care.